Smith, before you disappear, can I just ask what experts you talked to with regards to Sheila Annette Lewis? Yep. Thank you. She won't be taking any other questions. She just said she would be right back, so that's not true.
So you missed the media scrum?
Well, the guy said he was going to ask a last question. He didn't even look at me. I tried to get his attention. Is this the same treatment she gives to Sheila Annette Lewis?
If you don't do anything, then it speaks volumes, where you let the very people that helped vote you in down to either tell me you're either going to help me or you're not. Don't blindside it anymore. I don't say, well, you're going to listen to this or you're going to do this or you're going to, wait for this. There's no more waiting. Time is out. Like, I'm at the end of my rope now. I ain't got much longer. And I need your help now. Because if you don't help me, I'm going to die.
Sydney Fizzard, journalist and producer for Rebel News. Today, we interview Sheila Annette Lewis in person, who was denied a life-saving organ transplant, all because she chose not to get the COVID so-called vaccines. And we address Premier Smith directly to find out what second opinion she got in regards to Sheila's situation. Sheila has a Give, Send, Go campaign launched in hopes of getting her the transplant she needs to survive at a hospital in the United States, which doesn't require these same unscientific COVID novel vaccine mandates as Alberta Health Services does. You can find out more about this campaign at givesendgo.com/all caps GAMM5. Miss Lewis is also suing Alberta Health Services for medical malpractice, as she awaits for help from Alberta Premier Danielle Smith in hopes of getting back on the transplant list she was once already confirmed for as a great candidate. You can find all our coverage of this story at organsnotcoercion.ca, a campaign we launched at Rebel News to raise awareness on this medical injustice. What you're hearing now is the sound that keeps Sheila Annette Lewis alive.
I used to pray so hard to get a transplant.
These two are 24/7 without disruption. If even one of these goes down, she's gasping.
Lewis was diagnosed with a terminal condition right before the pandemic began, and from then on required a life-saving organ transplant to survive. Lewis did everything required of her to get approval for this transplant, even redoing all of her childhood vaccines. Lewis achieved patient status 2, highest priority. She was literally next in line for the organ she needs to survive. Unfortunately for Sheila, though, the COVID-19 pandemic was now acting as a catalyst to disregard informed medical decision-making, wherein politicians and doctors started using it as a tool for clinical and political coercive policymaking.
Will vaccines be mandatory, or will vaccine passports become part of the plan? The answer, Corey, is no and no. We have no capacity I don't even know what a vaccine passport is. All I know is this, that it's illegal based on the Privacy Act to ask somebody whether they've received a certain medical procedure or not, including a vaccine. So the government of Alberta, at least, will not be participating in anything like that.
That is why the government has reluctantly decided to adopt the restriction exemption program, a proof of vaccination program for participation in certain discretionary activities that have a higher risk of viral transmission.
The introduction of novel vaccines was touted as a carrot for restoring freedoms after 18 months of harshly imposed government restrictions. But for Lewis, awaiting her transplant, it was a death sentence.
I can't promise you won't have a reaction, but as somebody that manipulates the immune system on a regular basis, I am very comfortable suggesting and kind of being not suggesting, but saying you have to do this or else we'll have to put you on hold. That means that our program has decided that we need to do everything we can to optimize the benefit to our recipients and to optimize the use of our donors. So all of our pre-transplant patients are going to be required to have the COVID vaccine. Honestly, Annette, I don't say this lightly because I really do want to transplant you. I actually quite look forward to your 3 months post-transplant. I'm kind of excited to see how much going to drive? How much are you going to drive afterwards?
Lewis was moved then from status 2 to status 0 in November 2021, and would therefore not be selected for a transplant if the organ she needs became available, as she did not take the shot. At the same time, the Justice Center for Constitutional Freedoms stepped in to help Sheila seek her second chance at life through the judiciary. A long legal battle ensued, and publication bans were put in place, preventing doctors' names, the name of the organ Sheila needs, and the transplant hospital from being identified. In July 2022, a ruling from the Court of King's Bench in Alberta concluded that the Charter has no application to clinical treatment decisions made by treating physicians, and in particular, has no application to the treating physicians establishing preconditions for transplantation. The originating application is dismissed in its entirety. We interviewed Sheila and JCCF lawyer Alison Pejovich to get their reaction to this ruling. They later filed an appeal in the Alberta Court of Appeals. But around this time, another hope for Sheila was brewing. After over 2 years of increasingly restrictive COVID measures and vaccine mandates, exacerbated by political hypocrisy, Jason Kenney resigned, making way for now Premier Danielle Smith, who had taken a strong stance on defending those who weren't in favor of lockdowns or coercive COVID novel vaccine enforcement.
And we have to stop trying to victimize a particular group because they've made a different choice. So I know that that's going to be a little challenging for some people who've been holding a different view for a long period of time. But if I need to make the point that this kind of discrimination is unacceptable, the best way to do it is by changing the Human Rights Act.
Unfortunately for Lewis, in November 2022, Alberta Court of Appeals sided with the King's Bench ruling. What may have seemed like a dead end at the time was replaced that same month with a spark of hope for Sheila to receive her life-saving transplant. This new potential chance for Sheila to receive this care she needed to survive was created by now Premier Danielle Smith, who said she was looking into Sheila's situation directly.
I am seeking a second opinion on that particular case, and I know that there is at least one other case as well. So as soon as I have a result from that, I will let you know.
JCCF lawyer Alison Pejovich later requested for the Supreme Court of Canada to hear Sheila's case. While awaiting the decision, Lewis and her lawyers discovered that she had a healthy amount of antibodies and had developed natural immunity to COVID. AHS doctors had refused to test whether Sheila had natural immunity prior to this discovery by Sheila and the JCCF, who then sent a demand letter to the doctors involved and AHS, requesting for Sheila to be put back on the transplant list considering this new discovery. Unfortunately for Sheila, both parties refused. In visiting Sheila, she informed me that not only did doctors then say based on this health report that she would have to get boosted, so too did they say her family would have to get boosted as well. Hope was running thin for Sheila at this point, but the Supreme Court of Canada had yet to make its decision. Before that decision, Rebel News asked Premier Smith directly about Sheila Annette Lewis to find out what second opinion was had and to know what was being done to protect those in similar positions who are being refused healthcare over their novel vaccination status for COVID.
Is your government doing anything to ensure that unvaccinated taxpaying Albertans who fund this system are still able to receive timely and appropriate access to the healthcare they may need to survive?
I understand that organ transplant decisions are very complicated and they're made by a national body on the basis of survivability, and I'll defer to the experts on that.
It was a sour change of tone by the Premier.
Even though we have this underscoring of natural immunity, they are still trying to push vaccination on those who have natural immunity. And they're still not acknowledging natural immunity.
Hope was dwindling for Lewis in this campaigning Premier, but with a victory securing Premier Smith's position for years to come, the question of what would actually be done to secure life-saving healthcare access for tax-paying unvaccinated Albertans, or for those who weren't up to date with all of their latest boosters, needed to be asked.
Now, I won't be perfect, of course. We all know that. But when I make a mistake, I will listen, correct course, and learn from it so that I can improve and become a better leader.
Shortly after Premier Smith's election win, Lewis was left with no further options through the courts. as the Supreme Court of Canada had come to a decision on her case. Dismissed with costs to the respondents Alberta Health Services and ABC Hospital. We interviewed Sheila and her lawyer to get their reaction to this dismissal. One day after this interview, the Premier was in Calgary and was prompted for an update.
Oh, Smith, before you disappear, can I just ask what experts you talked to with regards to Sheila Annette Lewis? Yep. Thank you. She won't be taking any other questions. She just said she would be right back, so that's not true.
So you missed the media scrum?
Well, the guy said he was going to ask a last question. He didn't even look at me. I tried to get his attention. Is this the same treatment she gives to Sheila Annette Lewis?
The Premier did end up responding to my email inquiries with an exclusive statement we're making public today. And this is why we interviewed Lewis in person, a woman fighting for her life in what is supposed to be a post-pandemic Alberta.
So I asked the Premier what experts did she speak to, what was their feedback, and after hearing this expert medical advice, did Premier Smith say she would wait for a Supreme Court decision in order to decide what she could do to help Sheila? Here's the comment from the Premier's office. Many medical factors go into the determination of eligibility for organ transplants, and criteria is therefore decided by a panel of qualified medical professionals and not elected officials. What's your response to this answer?
She believes what she believes and whatever she's saying, but qualified doctors, I thought doctors were supposed to do the surgery on me. Transplant doctors were supposed to do the surgery. I didn't think they were supposed to play God. And as far as this life-saving surgery for me and many others that were denied, it comes down to the question of the vaccine. I want you to tell me. I want you to either reach out, personally to me, or I want you to tell the Canadian people that are waiting to hear a real answer from you. What are you going to do next? Or are you going to do anything at all? Because I know as Premier of a province, I know you have that power. And if you don't do anything, then it speaks volumes, where you let the very people that help vote you in down. I have a lot of hope in you, I really do. And when you first came into this province and was first elected for 7 months before you got re-elected again here last month, I had a lot of hope. I did a lot of praying, and I had a lot of hope for you. But that hope is going away real fast. So it's time to step it up a notch and either tell me you're either going to help me or you're not. Don't blindside it anymore. I don't say, well, you're going to listen to this or you're going to do this or you're going to, wait for this. There's no more waiting. Time is out. I'm at the end of my rope now. I ain't got much longer. And I need your help now. Because if you don't help me, I'm going to die. And it doesn't get any more drier than that.
We have an exclusive extended interview with Lewis that will be published shortly. And we interviewed her son Darcy as well, who's taken a lead role in supporting his mother at this time. Although options for this life-saving transplant are rapidly evaporating here in Canada, Lewis is a fighter, and she's taking action in two ways, with or without the Premier's help. Sheila has hired new legal counsel to take AHS to court for medical malpractice, which may result in her return to the transplant list. And she has a Give, Send, Go campaign launched in hopes of receiving this care at a hospital in the United States with doctors who don't require the same punitive COVID novel vaccine mandates. The cost is high. First, she must complete testing, which will be around $100,000. Then, once she is approved, the surgery will cost an additional $500,000. Canada's healthcare system has shown its true colors to Sheila Annette Lewis and those who are unvaccinated. But hope isn't lost, and supporters are beginning to gather rapidly to finance this costly international transplant. But every day that goes by is valuable time Lewis doesn't have. And you can find her Give Send Go at givesendgo.com/all caps GAMM5. If you want to see any of Lewis's additional interviews, those done with her son, her lawyers, or updates on the situation, go to organsnotcoercion.ca. For Rebel News, Sydney Fizzard. If you wish to see more of our reporting on Sheila Annette Lewis, go to organsnotcoercion.ca. And while you're there, consider signing the petition that we plan on dropping off to our health minister here in Alberta, Adriana Lagrange. We want to make sure that they know what they're doing has a real impact on everyday Canadians.